You're training consistently, you're strength training, you're doing stretching, you're doing everything right, and yet कुछ ना कुछ pain चालू हो जाता है after a long run, after a marathon. In my clinic, I see this often. A lot of runners tell me, "अरे we are doing everything right, पर ये pain बार-बार आ ही जाता है." If this is you, then watch this video till the end because there are some points that will definitely help you break the cycle of pain and run efficiently. Hi, I'm Dr. Rajani Patil. I'm a spine and sports physiotherapist practicing for over 24 years here in Shivaji Park, Mumbai. I run a clinic called Orthosports Physiotherapy where we are passionate about helping runners such as yourself run at their best. Pain that keeps coming back is really frustrating for runners. Runners don't like to stop running, you know that very well. In the clinic here, most of the time I try to tell my patients to modify their run, not necessarily stop running unless the pain is really severe. But there comes a point where it's so frustrating and you start wondering, you start doubting yourself, right? You keep thinking, is my training correct? Are my shoes right? What am I doing wrong? Sometimes it's not about you, it's not about your body. It could just be some critical element that you are missing. Remember, there are about 13 things that you should know as a runner, which I have told you about in this checklist. It's absolutely free. If you will comment below checklist, I will send it to you. Let's understand pain a little bit better. Most people misunderstand pain in the sense that they think कि pain आ गया है तो कुछ major हो गया है, कुछ damage हो गया है. That's not necessarily true. Pain is a signal, the first sign that your body gives you that something is off. So you need to listen to that, you need to respect that and understand why the pain has started and try to fix that. It just means that you as a runner, you may be training right, you may be doing everything correctly, but your tissues and your joints may not be ready to take the load or the stress that you are placing on it. So it may be some simple thing that you just need to decode. The solution that a lot of runners find is just to rest and stretch for some time, stop running or modify running and go back to running. This almost never works for runners. In typical patients, yes, sometimes that works, rest works, but not for runners. Rest can calm the tissues down, stretching will calm it down, but it doesn't necessarily correct the underlying issue that was there to begin with. So that's what you need to fix. So put in the comments, tell me which is the one pain that keeps coming back for you and you're still trying to figure out what is that's you're doing wrong, that the pain keeps coming back. So what is the real cause for the pain coming back? While there are several reasons for runners and some of them I have put here in the checklist, just go through each of these and see, just check them off if you're doing all of these right. But really when in the clinic we check a runner, when we assess a runner thoroughly, we are looking at whether your tissues are ready for the load that you're placing on it. So if you are running an X amount of mileage, is your body really ready for it? Is your strength training on par? Is your mobility drills on par? So that's what you need to think about when you are trying to identify the real cause of pain. I want you to start thinking about what are your weak links. For a runner, it's absolutely critical that your core and pelvic control is really good. Your hips must be strong. There are certain areas of the body that must be absolutely mobile. There should be good mobility. A runner should be able to do a full functional squat without any difficulty. Your core should be strong. Your glute max, glute med should be strong. If these are weak somewhere, then that becomes a cause for pain. If you want to know more about the weakness, I have made a video on it. I will put it in the link below. Check it out. So, as a typical runner, what do? You follow generic advice. Generic advice क्या होता है? जो friend बोलता है, runner बोलता है. Somebody who has been running and has some experience will tell you, just push through the pain, or they might tell you just rest it out or just change your shoes. So all these things don't necessarily work because every runner is different. what works for your friend may not necessarily work for you. तो आपको आपका कॉज फाइंड आउट करना है, किस रीजन से ये पेन बार बार आ रहा है, एंड उसको फिक्स करना है, नॉट जस्ट लिसन टू एवरी एडवाइस दैट कम्स विद इट. So what is going to help you break the cycle of pain? An expert's view is necessary in this case. If your pain is coming back, it's important to find the cause, and a sports physiotherapist who understands running really well is who you need. Of course, if the pain is really significantly high, then you must see an ortho and figure out if investigation is needed and X-ray, MRI is needed. But if not, then a gait analysis done by a sports physio or a detailed running assessment is absolutely the first place to start. When I do gait analysis in my clinic, I am helping runners figure out what their deficits are. Are there big strength problems? Is the mobility lacking? Sometimes just ankles that are stiff can cause an injury. Just glute med being weak on one side, that can be the cause. So this assessment is actually quite critical for you as a runner. I tell my runners every year try to get one gait analysis or a running assessment done, but if not, at least once in your life cycle as a runner you should get this assessment done. It tells you a lot about yourself, and that's the first clue of how you can fix this recurring cycle of pain. So if you need my help with this, I do these assessments online as well, but please do come down to the clinic if you are in Mumbai, and we'll do this for you. My number is on the screen. Get in touch and my team will help you out. So if your pain keeps coming back, you should not, one, stop running. Please don't be discouraged. Any and every pain in a runner can be fixed. So second, don't get discouraged, don't get demotivated, and I know that it can be really frustrating, but find the correct expert, find the correct reason for your pain, and the pain actually can go away completely. Understand yourself as a runner, understand your body, train smart, and do all the right things that will support your body to run fast and pain-free. If you need my help with this, obviously I'm here for you. If you think that this video was helpful, do share it with your running buddies, because a lot of runners ignore their pain till it becomes really bad, and then it becomes quite irreversible. And of course, subscribe to the channel and tap on the bell icon, because every week I have an interesting video for you that's going to help you run faster and injury-free.